Ladies and gentlemen, welcome back to MedSynapse, the podcast where we connect you with leading experts in the medical world. Today, we have the privilege of speaking with our esteemed guest, Dr. Vidya Kollu. Dr. Kollu is a highly respected specialist in hematology and oncology at the Genesis Health System in the United States. She has extensive experience as a bone marrow transplant hospitalist. She serves patients in Davenport, Ava, and Silvis, Illinois, with a strong dedication to patient education and providing excellent care. Her upcoming website, Cancer Conversations, is highly anticipated. Dr. Kollu, thank you so much for joining us today.
Thank you, Dr.Nigar, for the warm welcome. I'm delighted to be here, being part of the MedSynapse podcast.
Dr. Kollu will be sharing her expert insights on supporting patients and their families during their first visit to a cancer center, helping them work effectively with their healthcare team, and guiding them on asking the right questions. But before we begin, I would like to ask one personal question. Dr. Kollu, what inspired you to specialize in oncology and provide care to cancer patients?
Oh, that's an excellent question, Dr. Nigar, and it's a personal one too. So my journey to becoming an oncologist started 15 years ago when my grandmother was diagnosed with breast cancer in India while I was in medical school still. And it was fortunately and also by serendipity, it was me who diagnosed her with the breast cancer, and I took her through all the course of getting her started on all the needed treatments. And it was a challenging time indeed for our whole family. And that experience motivated me to pursue a career in the field. And I went on to apply for internal medicine. So I know that I could get into oncology only if I did internal medicine. And I was interested in treating adult patients. So that's how I got into oncology. And I'm now so grateful to be part of this journey for my patients and their families, helping them to navigate the complex world of cancer care.
Now let's go on with our questions. When patients and their families visit a cancer center for the first time, what are some common emotions they may experience, and how can doctors help address these emotions?
Yeah, so when patients and their families step into the cancer center for the first time, it's like stepping into a labyrinth. It's a whirlwind of emotions that go through, and the most common ones being anxiety, confusion, fear of the unknown, and an overwhelming sense of what lies ahead. And let's not forget the elephant in the room, the financial burden of treatments that the patients are worried about, as most of the patients are either middle class or lower middle class who are working. And as doctors, it falls upon us to guide these brave souls through their journey, using strategies and tips from all our training and also from resources like Vital Talks to address these emotions. And more often than not, we could fall into the temptation due to time constraints to avoid these emotions and to move on to just kind of talking some medical jargon, but that jeopardizes the whole purpose of the visit. Instead, if you could address the emotions, it would help in a better patient-physician relationship. And there are great resources in Vital Talks on how to handle these difficult conversations. For example, say if you're recognizing that anxiety, we can say things like, oh, I can see that you're feeling anxious. It's completely normal to feel this way. And we are here to support you through this journey. Like kind of addressing their emotion and also kind of normalizing what they're feeling goes a long way in making sure we are addressing them very effectively.
I believe building trust and empathy is so crucial in these challenging times. Providing patients with supportive atmosphere can really make a significant difference in how they perceive their care. Now, moving on to the next question, how can doctors effectively communicate this information to patients during their first visit, ensuring they understand their diagnosis and treatment options?
So communicating complex medical information is a crucial part of the first visit. So we must first listen to the patient's story, understand where they're coming from, what their fears are, what their values are, and use simple language to explain their diagnosis and treatment options. and try to stick to just layman terms and avoiding any medical jargon. Like for say, if you want to help them understanding the diagnosis, you can say that you have a type of cancer called, you can name it, but you can elaborate saying that this means that there are abnormal cells in your body, and going on to the treatment options, we can provide the options, like saying we have several treatment options and we'll discuss these to find the best option for you. So in the process, you're also making the patient included in the decision making.
Now let's talk about empowering patients to be active participants in their treatment and decision-making processes. What role can doctors play in fostering this empowerment during the patient's first visit?
So doctors can empower patients, first of all, by helping the patients accepting the reality of the diagnosis and focusing on the present moment. And these are kind of principles starting like the famous scripture like Bhagavad Gita, like, you focus on the present. These can be valuable tools for patients and families. And this helps prepare the ground for further educating the patients and answering their questions. And we can always have to let the patients know that they get to ask questions and reassure them that no question is too small or insignificant, and providing that comfort and welcoming atmosphere for the patients to ask questions would be one of the best ways we can empower our patients. And we can also provide them resources like on the cancer diagnosis so that the patients can read themselves and also making sure it's provided at an education level like most patients are comfortable with, like usually like something as simple as like say 8th grader can read or something like that, so that they can come up with good questions, and making sure they're welcomed whenever they are bringing these questions. And you could use that as a way to make sure you're providing personalized treatment care plans based on where the patient is aligned with in terms of all what's going on with their new cancer diagnosis.
Definitely, Dr. Kollu. I agree with you. That's a very crucial aspect. Empowering patients to be active participants in their treatment decision will definitely foster a sense of ownership and can lead to better adherence and overall satisfaction with their care. Moving ahead, preparing patients for their first visit is essential. Are there any specific tools or resources that doctors can provide to help them better understand their diagnosis and be well prepared?
So to prepare patients for their first visit, like general practitioners and referring providers are the ones who play a crucial role here. And there are various resources available at the American Cancer Society and Lymphoma Leukemia Society if there are blood cancers, and also on NCCN for patients for various different diagnoses related to various organs of cancer. And they are directed towards patients. So these resources are freely available. And if the general practitioners can take the time to educate the patients and provide and have their office staff provide the patients with these resources, and also with the new EMR systems where we can even send the patient information over to like patient's portal. So these are like all the good ways to explore on making sure we provide the needed resources to the stakeholders, which are the patients and families. And another part that goes into even for better utilization of these resources, as we talked earlier, is making sure they are accepting the reality of the diagnosis, because a lot of patients go through the grief of going through a cancer diagnosis and all the stages, including denial. So that's where the acceptance is a crucial component. And once we get to an acceptance part, then we'll make sure we do all the efforts on utilizing the resources to the best possible extent. So that would be crucial. And also acknowledging the power of, what we have control over now than being overwhelmed with what future holds is an important perspective that kind of the general practitioners can kind of coach. I'm not asking everyone to be a therapist here or anything, but at least directing the patient so that they can be provided with valuable lessons to overcome the challenges of a cancer diagnosis. Because it's the most dreaded word in the whole world, and I think we can do a better job as physicians and making sure we provide all the great resources that are available to our patients who need the most.
Now, let's talk about addressing misconceptions or myths about cancer treatment. How can doctors effectively address these during their first visit to provide accurate information?
Yeah, so there are definitely some misconceptions that we see on a day-to-day basis when we see our patients. And most of these come, interestingly, from Dr. Google and also the way media portrays cancer as a death sentence. And this ends up, and with all the personal experiences that are portrayed on the internet, many patients believe that, cancer is kind of a death sentence and that they wouldn't be able to, kind of live their lives, or say they're working, that they can't work or function, and all the things around that. So it is definitely a responsibility to make sure we debunk these myths during the first visit. And some of the way we could do this is using appropriate humor, which also helps patients open up more for more conversations, and reassure patients that it's not a all or none situation, and also address the concern with treatments. Like, everyone thinks that going through chemotherapy is like you'll be sick like a dog, but that's not true anymore. It was true maybe like a couple of decades ago, where there were no good supportive treatments, but we have come a long way in having better supportive care treatments, and we need to emphasize to patients that every cancer is unique, and each cancer, depending on what stage they have, the outcomes are different, and also that many patients continue to live a fulfilling lives, quoting examples from the patients we have seen, like with their similar condition, so that we can provide the much needed hope. At the same time, we are not trying to just sugarcoat anything when it's not needed, but making sure we are there to give the needed hope, so that we can better support patients to go through this a marathon of a journey through cancer.
Now, let's talk about how doctors can build trust and confidence in the healthcare team when patients visit the cancer center for the first time.
Yeah, so that's a very crucial aspect as it relates to even any other aspect of life, like trusting somebody with what you're dealing with, right? And especially when you're diagnosed with a cancer, it's of utmost importance to make sure the patients trust their oncologist and the care team. And it's of paramount importance. And patients need to feel heard and included in the decision-making process, which is a crucial step of even building any trust, as we have been discussing from the beginning of the podcast. And this can be achieved through active listening. And active listening is just not about, you ask a question and then you are already thinking about like what next question you need to ask. Not that, but just being genuinely interested in the story of the patient and what fears they have. And also making sure like you are listening to them from like a non-judgmental space, and also being able to address whatever concerns they are, bringing up, and also making sure you're introducing them to the multidisciplinary team that works, behind the scenes, and making sure they get a face to the name, introducing to the medical assistant, the nurses, or social workers, pharmacists, dietitians, and also other specialists like surgeons, radiation oncologists, nurse navigators, and financial advocates as feasible. I would make patients feel comfortable that they are getting a comprehensive health care, and that they have this whole team to back them up, and that they are working as part of their team with a common goal of their, support through all the cancer treatment and further.
Absolutely. Trust and active listening is the foundation of a strong doctor-patient relationship. Now, could you share an example of a patient who had a benefit from effective guidance during their first visit to a cancer center, leading to improved treatment outcomes and patient satisfaction?
Yeah, so that reminds me of a patient who I saw, who was an elderly runner in his early 80s. Was diagnosed with AML. He was accompanied by his family, which includes his wife and daughter, and they were clearly, understandably overwhelmed with all the diagnosis. but making sure like he was like using all the principles we talked through, like hearing where they're coming from, understanding their concerns and what they hope from going through the diagnosis and treatment for the AML. It was clear, and we were able to address his concerns and providing clear information. We were able to ease his anxiety and develop a treatment plan that considered his lifestyle and personal goals. And the rest is history. And he's doing good with the plan, and the patient family is very happy with all the outcomes, and they're just more than elated to see that he's doing so good and feeling back to where he was before he started on embarking on this journey. And if he hadn't had taken the time and understanding where the patient is coming from, it's so easy to put on a protocol and cookie cutter treatments, which might not be the best for patients. But making sure we understood what was important for the patient and what the main fears and concerns were, we were able to provide a personalized treatment plan for him with outstanding outcomes. So
that's an inspiring story, Dr. Kollu. Definitely, effective guidance and support can make a remarkable difference in the patient's journey and outcome as well. In our healthcare system, effective coordination and communication among the healthcare team members involved in the patient's care are crucial. What strategies can doctors implement to ensure this coordination for providing cohesive and patient-centered care?
Yeah. So effective coordination and communication is vital. And this all starts from like the general practitioners and referring providers. They play a significant role, like even in like the initial diagnosis and educating patients about the diagnosis. And also making sure they provide the basic resources that are available to the patients. And also, it's important to use all the tools that are available to help with these communications, like Vital Talks is a major one, which provides valuable communication tools for oncologists, general practitioners, even medical students or trainees, so that they can develop this important skill set to be working in this field. And this goes a long way in setting the right path for patient and shows that someone really cares for them and they are on their side through the most difficult, challenging times of their lives, rather than dread they have to face from getting an unsolicited call from cancer center saying that, oh, you have an appointment scheduled with the cancer center, and if they're totally blindsided in the process, if someone is trying to avoid the difficult conversations, there is nothing more harmful that can be done to a person's psyche than just getting that, dreaded call from the cancer center that you have an appointment. But developing the right skills for helping with these conversations doesn't take too long. This involves just giving patients enough time and needed information to process the diagnosis, so that they can be prepared to be active participants in ensuring discussions with the oncology team, and also ensuring that efficient transitions happen with different levels of interaction with the multidisciplinary teams. And this is going to be crucial. And with the EMRs, it's one way where all the team members can be involved, and that's a tool that can be used for advantage. And by no means I'm saying this to increase any more administrative burden than what already physicians have. But if that can be used effectively to make sure everyone is informed and being involved in care of this patient when crucial changes or to treatment plans are made, that goes a long way.
Absolutely. Teamwork and communication are vital for delivering the best possible care. Lastly, besides medical aspects, what other support services or resources can doctors recommend to patients and families during their first visit to help them navigate the emotional and practical challenges of their cancer journey?
Yeah, that's an excellent question. One of the common practical challenges patients and families face is not being able to keep up with the nutrition. And there are various services like, getting them enrolled on like say Meals on Wheels, and also nutrition advice, and also making them part of the support group so they can have a shared experience with other people going through similar journey. And also having them meet with the dietitian to help with the nutrition, and also physical and occupational therapy to help with their functional conditioning and any limitations they might have with getting around because of being too weak from the cancer, and also exploring other non-traditional ways of medicine like acupuncture to address some of the symptoms that could be related to cancer, like say if they have neuropathy or like treatment related neuropathy, or if they have like any issues with any chronic sleep problems. So all experimenting with all the holistic approaches, as well as being open to therapies like massage therapy when it's appropriate, as long as it's not being affected by low blood counts due to chemotherapy. And most important is getting them in touch with a social worker to identify all the community resources that are available, and also help with transportation needs and gas cards, as these are as we may take granted in our day-to-day life, but they're crucial for patients going through the cancer journey and more. So it almost takes a village to take care of our cancer patients, and that's what I would recommend to my patients usually.
Dr. Kollu, we truly appreciate your invaluable insights and expertise shared during our interview today. Your contribution is very valuable to us, and we're grateful for your willingness to share your knowledge on this important topic. Thank you very much.
Oh, thank you for having me here, Dr. Nigar. It was my pleasure. As a wrap up, I just want to let your audience know that, especially to all the practicing physicians and if there are any patients, being diagnosed with cancer can be overwhelming, but with the right support and guidance, patient can navigate this challenging journey. Acceptance of reality, focusing on the present, and maintaining a hopeful outlook for the future can make a world of difference. And as the Bhagavad Gita teaches us, change is the only constant. So let's embrace change, seek knowledge, and make informed decisions about our health. And to the providers who are listening, remember, as doctors, we are not just treating a disease, we are treating a person with emotions, fears, hopes, and dreams. As Maya Angelou once said, they may forget your name, but they will never forget how you made them feel.
Thank you so much for your advices, Doctor. And before we conclude, we would like to take a moment to acknowledge MedSynapse. MedSynapse is a leading platform that brings together healthcare professionals, fostering collaboration and knowledge sharing. We encourage you to subscribe to MedSynapse to stay updated with their engaging discussions and gain access to a wealth of knowledge from experts in the medical community. Don't miss out on the opportunity to expand your understanding and stay informed about the latest developments. That's it for today's podcast. Thank you for joining us. Stay tuned for our next episode. Take care and stay curious. Goodbye.